Welcome. My name is Suzanne Smith, a nurse practitioner in the UCLA Integrative Digestive Health and Wellness program. I am here to talk about the benefits of diaphragmatic breathing and demonstrate the technique. Today, in this modern world, with so much distraction and busyness, we forget to breathe slowly and be present for our lives. Diaphragmatic breathing is a great tool to bring us back into the moment, connect to the body, and regulate the nervous system. It is always accessible, and we can practice in any moment. Practicing the breathing regularly can result in a reduction in gastrointestinal symptoms, such as acid reflux, abdominal pain, bloating and distension, and constipation. It also promotes relaxation, stress reduction, and a balanced nervous system. You can practice this breathing standing, lying down, or sitting in a chair. Begin by placing one hand on the chest and one hand on the belly. Take a deep breath in and out and explore which hand has more movement. Most people will notice the hand on the chest moves more, like so. This is chest breathing. And when we are engaging in chest breathing, we are only breathing into the tops of our lungs, and we're not getting optimum air exchange. If you noticed your bottom hand moving more, then you are one step ahead and are breathing from your diaphragm. You may release your hands into a comfortable position. I will now give instructions in 3 steps and then demonstrate the technique before we practice together. First, breathing in slowly through the nose until there is a little resistance in the chest as the diaphragm contracts and moves downward, pulling the air down into the bottom of the lungs. The belly relaxes and rises, and the sides of the ribs expand. Second, pause in between the inhale and the exhale. Third, the air will slowly be released through pursed lips, just as if we blew up a balloon and we're holding it between our thumb and index finger, slowly controlling the flow of air, facilitating a longer exhale, like this. As the breath is released, the diaphragm moves up and pushes the air out of the lungs. The belly falls and the navel moves inward toward the spine, where a slight contraction is felt in the belly. When practicing diaphragmatic breathing, it is important to be relaxed. So whether lying, sitting, or standing, please bring your attention to the surface that is supporting the body. Allow the body to soften the best that you can. And then on the next out-breath, allowing the shoulders, chest, and belly to relax as the body lets go of the breath. I invite you to find a comfortable position to practice the breathing. You may want to pause the video and resume once positioned comfortably. Placing one hand on the chest and one hand on the belly, we will take 3 diaphragmatic breaths in 3 steps. Step 1, breathing slowly in through the nose as the belly rises. Step 2, pause. Step 3, slowly release the breath through pursed lips as the belly falls, navel moves towards the spine. Again, breathing slowly in through the nose as the belly rises. Pause. Slowly release the breath through pursed lips as the belly falls, navel moves towards the spine. And again, breathing slowly in through the nose as the belly rises. Pause. Slowly release the breath through pursed lips as the belly falls, navel moves towards the spine. If the breathing becomes too mechanical or difficult, or you feel dizzy or have excess yawning, that is a sign of over-breathing or using too much effort. When you find this is the case, Let go of trying to control the breathing. Allow your body to relax and start over. After practicing, remember to take care and change positions slowly. So you might wonder why diaphragmatic breathing is beneficial. The diaphragm is a dome-shaped muscle that sits at the base of the lungs. And the vagus nerve is the longest nerve in the body, connecting the brain to the gastrointestinal system. It has a major role in the continuous feedback loop between the brain and the gut. The vagus nerve runs through an opening in the diaphragm. So when we breathe slowly, activating the diaphragm, the vagus nerve gets stimulated, which sends a message to turn on the parasympathetic branch of our nervous system, often known as rest and digest. This results in the relaxation response. So by simply altering our breathing, we can alter our physiology, creating a state of relaxation and ease. Next time you notice tension in your mind or body, remember to breathe from your diaphragm to create more ease. For better GI health, take some slow diaphragmatic breaths before and after meals. This can facilitate better digestion and motility. There is evidence that when practiced regularly for 10 to 15 minutes once or twice a day, there is reduced activity of the sympathetic nervous system, known as fight or flight, an increase in vagal tone and heart rate variability, which are indicators of a resilient and balanced nervous system. Don't worry if you don't get it right away. It's most helpful in the beginning to practice lying down. With regular practice and allowing the body to relax, it will become a natural rhythm. If you need more guidance, I provide individual sessions through the UCLA Integrative Digestive Health and Wellness Program, remembering that how we breathe is often how we live.